Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to officially welcome you to episode 194 of the Ask Dr. Angela podcast. Can you flipping believe it's episode 194? We're going to be hitting 200 pretty soon. Anyway, I hope that you all are well. We are having an amazing weekend here on the shore. Yesterday was in the 60s. My wife and I had an amazing time hanging out in Asbury Park, doing what we do best, which basically is eating and shopping. We went to this amazing vintage shop in Asbury. And, my wife is pretty amazing. She functions as both, not only my wife and friend, but also as my stylist and in-house fashionista. So we went into our favorite vintage shop, and she managed to buy me like 4 or 5 amazing pieces for like $50. Now, what you have to know about me is I do have a great eye, but I can't even buy myself one thing for $50. But these finds were amazing. I mean, whenever we go into this boutique, the owner is like, oh my gosh, here comes trouble. First of all, because she knows that we're never going to walk out of her store empty-handed. But, these items and the prices are like purely orgasmic. I'm a little person. If you've seen me, I'm all of 5'3" and like $1.15. But I got a pair of cargo leather pants, a pair of amazing wide leg, low hipster, navy blue pinstripe dress pants with like the details on like the seams. And it has zippers, just amazing. I got an amazing blazer, an amazing top. And then my wife got this really vintage 2-piece outfit. It's like a jacket and a beautiful dress. It looks like something that Natalie Cole is rocking on one of her 1970s albums. But the more I looked at it, I was like, yes, honey, you are going to rock that. So let's jump right into today's podcast, which is on rectovaginal fistulas. Now, the reason that this topic came up is that I received a direct message from a fan in Southern California, and she reached out to me via direct message, and this is what she said to me. Dr. Angela, I wanted to make the women in my life aware of a risk of a long labor that is never even brought up. I had a 32-hour labor, episiotomy with the vacuum delivery, and a baby weighing 8 pounds, 15 ounces. And even before this, never even heard of this condition. I had to literally Google poop coming out of my vagina to even know what was going on with me before calling my doctor. So I guess I'm writing to you in the hopes that you can make room in your podcast to discuss RBFs, i.e. rectovaginal fistulas, even if it just briefly makes your listeners aware that fistulas are alive and well here in the U.S. and are not eradicated as some research would have you believe. Yes, it's absolutely gross and embarrassing, but it's real life, and it's happening to many of us. So thank you so much, Miss Southern California. That's how I'm going to refer to you because, we keep it completely anonymous here on the Ask Dr. Angela podcast. But I was so moved by your willingness to share this. Not only did I do a blog post, which you can find on www.askdrangela.com. That's ASKDRANGELA. But as promised, here's your podcast. So here we go. Just what in the bleep is a rectovaginal fistula? Well, a fistula by definition is an abnormal communication between two organs. In this instance, it's an abnormal communication between, you guessed it, your rectum and your vagina. So what causes rectovaginal fistulas? A lot of stuff. Childbirth, as we just noted. Any kind of inflammatory process like ulcerative colitis, Crohn's disease, people that have any kind of irradiation of the pelvis due to, say for instance, cancer, people that have a history of pelvic surgery can get these. Of note, rectovaginal fistulas are only one type of fistula. The other type of fistula that I commonly see in my realm are vesicovaginal fistulas, which is basically a communication between your vagina and your bladder, i.e. instead of leaking poop, you're leaking urine. And of course, everything that you were so kind enough to share with us already tells us what risk factors associated with rectovaginal fistulas are as relates to childbirth. I mean, hello, long labor, instrumented delivery, you did mention the vacuum, large babies, and our friends, so not episiotomies. So what are the symptoms? Boom, you hit it right on the head. Poop coming out of your vagina. I mean, does it literally get any better than that? And with regards to complications, again, what is worse than stool coming out of your vagina? And talk about the embarrassment, the smell, increased risk of infections, hygiene issues, the irritation. I mean, the list goes on and on and on and on. So with regards to identification and treatment, sometimes it's really as simple as noting gas or poop coming out of your vagina. And in other circumstances where it's not so obvious, there are a lot of tests that we can do, imaging that can be performed, whether it's a CT scan, an MRI, a barium enema, a vaginogram. That's funny, a vaginogram, right? Kind of like Instagram, but a vaginogram. But anyway, usually treatment of a rectovaginal fistula is going to involve some sort of antibiotic treatment to kind of cool down the surrounding tissues to make sure that they aren't inflamed or that they are not infected, because you need nice, healthy surrounding tissue in order to have a really good repair. Sometimes fistulas certainly can be small enough that they'll close and resolve on their own, but in other circumstances, surgery is certainly going to be necessary. And typically surgery is not done for 3 to 6 months after the diagnosis. And again, sometimes this delay in closure can yield an adequate opportunity for either the fistula to close on its own or to give the surrounding tissue an opportunity to become healthier and free of inflammation. So I certainly hope that this helps. Thank you so much for reaching out to me. And just for our listeners out there, I did subsequently receive a follow-up message from the same listener, and she is scheduled to have her surgical repair. So we are all rooting for you, and thank you, girl, for sharing this with us. If you happen to have a topic or a question that you would like featured on the Ask Dr. Angela podcast, you know where to find me, www.askdrangela.com. That's AskDrangela. And you just gotta check out the new website because it is amazing. Not only visually appealing, but it has everything on there. You can sign up for my newsletter where you can get my weekly newsletters that also highlight the blog posts which come out every week. And not only are they informative, but they're like flipping hilarious. You can subscribe to all of my social media outlets, whether it's my amazing YouTube channel, the podcast, and again, any of my social media venues, Instagram, Facebook, Twitter, it's all there. So hit me up. In closing, I would like to leave you with this. And this is from one of my favorite books, She Went Out on a Limb by Sandy Gingras. Remember that pitfalls in your path are places to plant seeds. Until next time, look better, feel better, be better. Can't wait to reconnect on episode 195 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.